Over to Dr. Mercy Korir, who is our moderator for today, who will guide us with this session. Daktari, over to you.
Thank you. Thank you very much, Mike. Good afternoon, Mr. President. We've had a successful two-day summit where we are discussing health. And for everyone here, if you're not affected, then you know somebody who's been affected. And that's why this is a very important conversation. The culmination yesterday was a town hall that we had. Very, very fruitful and engaging conversation with everyone who's here, some of them, and those who are watching at home. So today, we also want to continue listening to Wananchi who are here. Some are watching us online. We have different groups that are represented here that would want to speak to you directly during this town hall. But before we start, I don't know if you have any brief remarks or anything brief to say, then I open it up for the Wananchi in the hall.
Fellow citizens, good afternoon. Hamjambo. Yes, I think this is the second day of this very important health summit. And yesterday and part of today in the morning, we've gone through the motions. From yesterday to today, we have seen the commitments that we made as an administration. We have taken a stock take of what we have managed to achieve, what we have done in furtherance of our commitment to the people of Kenya. And this session is not another session for me to tell you more. This session is a session for me to listen, to get some feedback from the 2 days of interactions in different spaces. I know in our midst we have practitioners, we have health workers, health professionals of all levels, doctors, nurses, clinical officers, and all the other people, all the way to CHPs. We have managers of hospitals, we have my friends, governors who are here. We have those who run our hospitals, suppliers of different items, equipment, medical commodities, and everything else in between. And we have Kenyans who have experienced universal health coverage in one way or another. This afternoon is a session for me and my team to listen and to get some feedback on what you think is working, places where you think we can improve, and also I would want to listen to some ideas on what you think we should be doing beyond 2030. How would you want this space to look like? What additionally can we do? What spaces can we improve? So that is the session that I have come for, and I have all ears, or I'm all ears to hear from the good citizens who are here, those online, those watching us from home and other places. This is your moment. Thank you very much, Mercy.
Thank you. Let's appreciate Mr. President. So for today, I'd like us to start with lived experiences, with people telling their real life stories. And before we came in, there's a gentleman called Shikuku who I met, who was telling me about his sister's experience, had surgery, and he himself also had surgery done. Could we have Shikuku? Let me single him out so that we can start with him. Where is Shikuku seated? There he is. Okay. Tuambie tafadhali. And unaweza kuzungumza kwa Kiswahili ama Kizungu, the language you are comfortable in. Asante.
Thank you. His Excellency, Mheshimiwa William Samoei Ruto, all the governors and the MPs who are with us now, and the MCS and distinguished guests, Hamjamboni. Mimi kwa majina naitwa Crispinas Kuku Wafula, ni mkaaji wa Dagoretti North, lakini kwetu kule ni Bungoma County. Natoka sub county ya Bungoma South. Mara yangu ya kwanza kwa experience maneno ya SHA kufanya kazi ilikuwa last year, His Excellency, ambapo sister yangu alikuwa mgonjwa. Wakati alikuwa mgonjwa, ali have to undergo surgery kule Riale Hospital in Eldoret. Alikuwa anafanyiwa surgery, alikuwa na fibroids of which tulitoa uterus. Na SHA ilitusaidia katulipia 98,600 November last year. Mgonjwa anaitwa Violet Muyoka Nalianya. SHA imekuja kanisaidia tena. Mimi mwenyewe nilikuwa mgonjwa Mechumeru Health Hospital. It is a health center, ilikuwa dispensary, lakini sasa hizi a health center, of which nilikuwa mgonjwa malaria, nikalazwa 3 days mwezi wa 4, na SHA ilinilipia 20,000. Si kutoa kitu hata ndururu wakati nilipeana ID yangu. Tena juzi last month tarehe 13, sister yangu ambaye anaitwa Caroline Faiza Simiyu alikuwa amenitembelea hapa Kaongware, akawa mgonjwa, nikamkimbiza hapa Luton Hospital, iko Nairobi County, opposite Coptic Ngong Road. Nilipofika hapo, madaktari wa hapo waligundua alikuwa na septic shock. Sasa mambo ya septic mimi sijui, mimi si daktari, mimi ni driver tu. So alipopatikana na septic shock, tukamweka hapo. SHA before tumadmit, His Excellency hakukuwa na SHA. Pale hospitali waliniambia endeni umregister SHA ndio urudi. Kwa kweli Luton Hospital, kutoka Luton Hospital mpaka SHA office center hapa hill, it is 2 km. Nilienda na ID yake, nikaenda na simu yake, mimi nikamregister. Compared to SHA to NHIF kitambo, haingefanya kazi immediately mgonjwa akiwa anafanya kazi. Hata kama ni kizuri tu. Tusione kizuri tuseme ni kibaya. Nilimregister na nikakuja nikamwadmit na SHA. SHA ilinisaidia pale hospitali, tayari sisi alifanyiwa 2, SHA ikalipa yote. CT scan SHA ililipa yote. Alikuwa ICU for 12 days. SHA ilikuwa inatulipia 28,000 here at Luton Hospital. Wakati tulimdischarge, SHA ilitulipia 369,600. Mimi ndio niliadmit sister yangu. Thank you for SHA. Na in summary, Mr. President, nataka kueleza kitu kimoja. SHA is working. Lakini shida ni moja. Ni pale kwa mahospitali ndio kumeosa. Kwa sababu vile nilikimbia kwa SHA office, walinihutumia within 10 minutes. Nimeenda nimeadmit sister yangu na SHA, na tulilipa mwaka mzima 1,000 ngapi? 6,000, His Excellency. So naomba tu mwenye anasema SHA haifanyi kazi, hacha konjeka. Lakini siku utakuwa mgonjwa, utaona kweli SHA inafanya kazi. Alafu upande wa SHA kuna kitu inaitwa system developer. What is system developer? Mimi niko hospitali, nimekuja kuadmitiwa, na kufika hapo kwa mashini ya SHA wananiambia system. Lakini sio system, wanakuangalia kama una pesa, utumie hiyo pesa, kutanganyia ni system. So Mr. President, wakati ukiwa Minister of Agriculture, ulifanyia kazi kwa shamba. Minister of Education nikakumbuka, ukafanya nini? Ukashukisha from P+ ukaleta C+. Sister yangu saa yako university, Mr. President. So ni yeko kuu. Sasa ambia hawa maminister tafadhali, msilete Mr. President down. Kwa sababu ya nini? Yeye ameimplement. Tafadhali simuendeleze tu. Kwa sababu tukiangalia kama level 4 hospital, ukienda huko utatibiwa kila kitu. Lakini Mr. President, jana ulisema kuna mashini ya MRI nini. Chusi nimeenda one of the county hospital, I think His Excellency Governor wa Nairobi uko hapa. Nilienda Mbakati na mgonjwa, mimi ni mtu wa upa. Kufika huko X-rays walinituma Luton Hospital. Ni nini kinaendelea Mr. Governor? Tusaidie tu, kwa sababu president anaweka bidii. Au watu wako wa ground Mr. Governor, uko na Minister of Health nini? Minister mwenye anasimamia nini? Hospitali. Mwambie atoke kwa ofisi atembee, mfuate nyayo za His Excellency Mr. William Samoei Ruto. Thank you.
Thank you. Thank you. Asante sana. Asante sana kwa kutuzungumzia. We'll take all the comments, and then at some point we will respond to all of them so that we get as much feedback as possible from all of us who are here. We have somebody with a lived experience from cancer. Somebody with a lived experience from cancer. Where are they in the room? If they are here, asimame tafadhali. Yuko pale. Sawa.
His Excellency, Mr. President, my name is Esther Wanjiko, a stage 4 breast cancer survivor, and this is my 4th year. Niko mbele yenu na mbele ya wananchi wote wa Kenya nikisema vile SHA imenisimamia. Kila mtu anajua kansa, jeni ya kansa vile ni ngumu. Na mtu akisikia mtu ako na kansa unaogopa. Na wewe mwenye umeshikwa na kansa unagojea kukufa, sababu ya life experience yenye watu wameshapitia. Lakini niko mbele yenu kusema kansa inapona, na usiogope kutibiwa kansa, sababu SHA inasimamia, na mimi am a beneficiary, and I thank God and I thank you Mr. President kwa kuleta hii scheme ya SHA. Cancer patients wanajua vile ni gumu sana, na ile treatment mimi napata ni very expensive, na ni among the most expensive treatment kwa breast cancer. Natumia dawa inaitwa Herceptin, na nikianza treatment 2023 it was costing 135,000 after 3 weeks. You are supposed to take that medicine after 3 weeks. Now, wakati huo sikuwa na pesa, na hiyo scheme nyingine ilikuwa inasimamia treatment ya cancer. So I had to do a fundraising which costed me, iligaramika tu, ilinisimamia tu just 2 sessions. So after that, nilikaa tu nigoje nikufe. But fortunately, nikakaa after sometimes bila treatment, na nika give up. Hatimaye nikaongeleshwa na watu, nikasaidiwa na watu, tukaanza kwenda the kienyeji way. But wakati SHA ilikuja ndio nilianza treatment, na even now I'm under treatment. Hiyo accept tunapata saa hii tunapata weekly, na through collaboration ya SHA with the government with cancer. Kweli si kweli? Ni ukweli. Kila familia, kila mtu kimsimamisha atakwambia rafiki yangu ako na kansa, mama yangu ako na kansa, baba yangu ako na kansa, brother yangu, anyway. Kansa imekuwa ni kama disaster. So tugeomba hata kama SHA inasimamia, wacha dawa zikuwe free kama za HIV. Tuko tayari kukunywa dawa ndizo hazipatikani, na wenye wanapata ziko very expensive. Wacha hiyo tu ya Herceptin peke yake, zingine tunatoa kwa pesa kwa mfuko. Situmii Herceptin peke yake, natumia dawa inaitwa Zora, na uko nyumbani utapata hiyo matibabu na hiyo chakula namna gani. So tunaomba kama umeshikwa na kansa na ulikuwa umeajiriwa, tupatie tu nafasi nyinyi waajiri wetu, tufanye treatment, then tukuje tuendelee na kazi yetu, sababu sikupenda kwangu kugojeka. Na pia wewe unaweza gojeka. Usinitenge sababu niko na kansa. Usiniweke kando sababu nimeshikwa na kansa. Kansa si ya mtu na hakuna mtu anaitisha. So tunaomba after cancer, please, kuna palliative, tusimamiwe. Another thing, vitu zimekuwa bei kali. Mimi ni patient wa KNH, Kenyatta National Hospital. Tumeongezwa pesa ya kuona daktari from 1,050 to 1,550. Tulikuwa tunakosa hiyo 1,000. Tumeongezwa 1,500. ni wengi, hata wanakosa mpaka transport ya kutoka kwa nyumba kwenda kupata hiyo treatment. Then nimemwambia aongezewe 500 from 1050 to 1550. Tunaomba hapo utuangalilie vizuri. Tunaomba sana sana.
Shukran Esther. Asanti kwa kutuelezea your own experience. Let me at this juncture, do we have any of
Maybe before we go to the next, just for clarity, Shikuku has said we need to do more to make sure that equipment are available in more of our facilities. I know we have a program with our county governments. Yesterday, the faith-based hospitals also said if it is possible for us to consider them in the supply of equipment under our NEST program, it would be a good thing. And I think that is what Shikuku was saying, that we need more facilities with the correct equipment for purposes of treatment. Waziri, do you have some ideas on how we can make equipment much more available in more hospitals? What is the strategy? Because I thought we have a plan.
Your Excellency, let me talk for the public health facilities, those which are under the county governments and under the national government. It is very easy to place equipment, and we have done that in over 239 facilities across the country in major equipment. We are only having a MRI in 2 facilities, which we now intend in the next 1 month to upscale to about 20. So we get requests from our county, our counties, because we have signed an partnership agreement between us, the national government and the county and the vendors. And we're going to now reach out to the faith-based. But just on 2 things, and I'm very happy the lady who was speaking on behalf of the cancer patients. The reduction, the cost of care in Kenya is a problem we must all discuss. Government, the private sector, pharmaceutical companies. And what she says from 135, that particular drug, to 40, is as a result of an MOU the Ministry of Health have signed with Roche, one of the biggest pharmaceutical companies. And we are going forward to do the same with Pfizer. Pfizer, as a pharmaceutical company, supplies most of the essential medicines in our country. So the president of Pfizer is coming to see you next week. But I have done a rider that before he comes to see you, the condition is that of the essential products that his company sells to Kenya, there must be a price reduction. So equipment, Your Excellency, I agree. We're going to upscale. Finally, Shikuku said about system, and I agree with him. There are facilities that tell our citizens that the system is down. And I want to give this to Anthony, and Mercy knows. Our systems downtown is very fast, and facilities level 5 and 6 and even up to PhD, we can tell. But there are facilities in our country, and I really want to speak to our citizens. Do not fall into the trap when you are told the system is down so that you pay out of pocket. This is a message we must pass to our Today, out of the 44 counties, 39 counties at least have 1 CT scan in their sub-county referral hospital. Some have 2, and I'll give the example of Bungoma. in Bungoma County Referral Hospital and in Webuye. Nairobi, I'm sure Governor Sakaja is here, and this morning we had a testimonial from citizens that there are more equipment in the Nairobi County hospitals and facilities before 2022. So I really can only say that, but this is very good.
Thank you. Thank you. We will go to the matter of cancer because this is a listening session. Chair of Council, when we signed the intergovernmental partnership agreement, we informed counties and we actually worked with them on the list of equipment available under that program. And it was our expectation that every county will request the equipment which they think will assist them in delivery of service. Is there anything we can do more, Chair, to persuade, to get counties to onboard the equipment? Because I think we had only one county who had not signed the IPA agreement, that was Kiambu County. I'm told last week they have now signed. So there is no reason why every facility in Kenya should not get at least the minimum equipment so long as they have the number of patients that will justify the installation of those equipment. Do you want to say something, Chair?
Nairobi Governor might also want to say something. Your Excellency, with respect to the NESP, the National Equipment Support Program, we have intergovernmental agreements between individual counties and the ministry. This can also be amended with respect to what is ordered. If a county that had signed up for 5, say, equipment realizes that they need more, nothing stops them from signing an addendum to request more. And I know in my county, the more we have upgraded facilities, we have actually increased that request. And for a place like Nairobi, I'm sure the governor is going to speak, where traffic of patients is not a problem, there's no reason why, for instance, Nairobi cannot have more facilities with more equipment. The cancer centers have been more regional, save for places like Nairobi. In the rest of the country, they have been at the what we used to call the general hospitals at the provincial level. But now there is a lot more counties. By the last count, at least 28 counties now have a level 5. Initially, level 5s were only at the provincial headquarters. I would now expect, Your Excellency, each of these level 5s to set up cancer centers and to ask for equipment through NESP so that we can further decentralize cancer treatment, Your Excellency. Thank you.
Thank you very much. Governor of Nairobi, something has been said about Mbagathi, but I know for a fact that Nairobi County is among the counties that we have supplied quite a bit of equipment. Governor?
Thank you. Thank you very much, Your Excellency. And thank you, Crispinas Shikuku. All our facilities have equipment. But what we want to raise, Your Excellency, is, and I'm very happy about this very candid discussion, where you have provided medicine, we have provided medicine as counties. Nairobi, a hospital like Mbagathi had X-ray even before the NEST program. It's a big hospital. We need to sort out what we call the weakest link. And it's a problem across the country. Your Excellency, let me start with an example. The time I went to Tasia, Kwandege, level 4. And I knew that we had just applied medicine the day before. When I was leaving, a young man, normally they come comes and says, Governor, nimekuwa hapa jana dawa nimeambiwa hakuna. So I said, no, I know those medicine. Give me that list. When you look at what has been asked for, and I forced the opening of the store, it was there. But somebody told him, hakuna dawa, enda kwa ile chemist across the road, because either they own that chemist or they're getting a cut from that chemist. Mara mingi, like today, there's no hospital that should say it has no medicine, for sure. But many times, that weak link is the human link of some unscrupulous people, and we've taken many for disciplinary, and I know my colleagues have gone through the same, who will tell a mwananchi that the machine is not working. I know for a fact Mbagathi has functioning X-ray and all that equipment, including from NESP, all our, I think 45 or so facilities, all level 5 and 4s have been stocked. But how we sort out the place where you're told the machine is not working, because the person telling you that is getting a cut from that private facility for referring people to that facility. Now, there are options we have, Your Excellency. One, we can have a helpline where if mwananchi ukiambiwa hakuna dawa, tuambie, nimeambiwa hakuna dawa kwa hospitali hii na huyu. Nimeambiwa mashine haifanyi, nimeambiwa kwa hospitali hii na huyu. If you can work with the DHA for that, then we can isolate the individuals, because Excellency, you can set systems, you've set. Equipment we have put. Machines ziko. Dawa tumeweka. That weakest last link, which is in major part, and many of our health professionals are very good. But there are few too, sini kweli? Ama nasema story yangu. There are few who, because of corruption, which is what we must deal with, anajua akirifa Luton atasema nimetuma Shikuku. If Shikuku comes and pays 5,000, 2,000 ni yake ama 3,000. Excellency, that is the problem. But in terms of equipment, we have them in all our facilities, Excellency.
Thank you very much, Governor. And I think it is a point of feedback from what Shikuku has said, that we have a challenge that we need to sort out. And that challenge we are going to sort out if citizens also help us. So I think what Governor Sakaja is saying is, if you go to a facility and, like, for example, what Shikuku was saying, Mbagathi is a public facility. He was referred to a private facility to undertake a certain procedure, because whoever referred him, because I know Mbagathi, Mbagathi cannot be among the hospitals without an ICT machine or X-ray machine for that matter. But because that reference benefits somebody in some way, we should, therefore, with the assistance of DHA, be able to work with citizens if they go to a facility and in the facility they are told either this equipment is not there, go to the next, or this medicine is not here, go to the next. They should be able to verify. This is homework for us. This is feedback for Mercy and for Anthony and the PS and Minister, for us to go and figure it out and work with the counties to make sure we get rid of that mischief. So thank you very much, Huku, for that. Now, the second one is Wanjiru. Wanjiru has very emotionally talked about cancer and the support we are giving them. I remember very well the MOU that Duale has referred to when we were negotiating with the manufacturers to bring the price of that particular cancer medicine from 135,000 to 40,000. Because our argument was, as government, we have a pool of patients. We need to benefit from economies of scale. And they agreed to bring the price down substantially, actually to a third. There is a catalog of more equipment. Because of where we are today, and this is important for Wanjiru and all of us to know, that there is power in us negotiating as a government. It is the reason why we agreed with the counties that instead of every county going to negotiate with suppliers on their own, let us pull together. We will provide leadership so that we negotiate as a bloc. That way, we have greater power of negotiation. So, to the point of Wanjiru, we've managed to do with one company, Pfizer. I met the president of Pfizer once. I'm doing another appointment with him because quite a substantial part of the medicine that we are using comes from Pfizer. And our engagement with Pfizer now is that they will not be supplying our facilities individually. They will be supplying us collectively. And that is the point why Duale is saying we are going to engage them this time round so that we can negotiate the prices the same way we negotiated the prices for Roche and all the others. So to your point, Wanjiru, we have understood your feedback. We're doing something about it to make sure that we bring those other prices down. But there is one more thing that Wanjiru has said which we have to answer. Wanjiru has said that there is another 1,000 that has become 1,500. And I think she is saying that it is not covered by our SHA. What do we have to say to that? Somebody help me, whether PS or who? Because, yeah?
Yeah, Your Excellency, I think the CEO and Dr. Mercy can answer that.
The CEO
of Kenyatta National Hospital and also SHA.
Okay, so Mercy,
Thank you, Your Excellency. As I hand over to Dr. Lesiampe, it is correct, Wanjiru, that you do have to pay 1,500 for your outpatient visit. Your Excellency, what we are doing about this is, like we mentioned, at the end of October, we are reviewing a benefit package. And we are reviewing the outpatient benefit package. Many Kenyans, Your Excellency, have come to us and told us that SHA is doing well, but we need to do something at level 5 and 6 hospitals outpatient. So far we have our numbers. We'll be presenting them and defining a plan in how Wanjiru and those costs can be diminished or at least reduced at the end of October, 30th October.
Now, just to the point, this is a challenge that faces not level 2, not level 3.
Not level 4,
not
level 5
4.
and 6.
So level 5 and 6.
Yes.
Because my understanding was that for level 2, level 3 and some level 5, for
level
outpatient facility, it's covered fully by SHA.
Yes, so Your Excellency, just to clarify, level 2s, dispensaries, health centers, and level 4s, specific level 4s, it is covered by SHA on a walk-in, walk-out. But for certain level 4 facility entitlements, level 5s and 6, it's not covered. So we've had that complaint from many Kenyans. The simple procedures where you need a specialist in a level 5 who might not be in a dispensary or a health center or a level 4, but is available in KNH. So we are working it out so that we get a package and so that we're able to reimburse for that.
Very good. So again, Wanjiru, this is very good feedback. We are working on a benefits package for SHA. We had an initial one because we also wanted to be sure that we don't say we are going to pay for so much and yet we had not had an experience of whether we would be able to pay or not. With the benefit of a year and a half of working with the benefit package that was there, we are now ready for a review on areas that citizens like you, Wanjiru, has come back to us and say, there is this pain point on my visit for cancer treatment. I do not know whether there is any added value the CEO of Kenyatta Ken. I think it has been answered effectively by Mercy, because that's the truth, all right? Lesiampe, do you want to say something? Continue.
Thank you very much, Your Excellency. I don't think I need to add anything. We are going to see how by the end of October that this package can be reviewed so that we can assist some of these patients. These cancer patients go through very, very difficult times, and indeed that's why we have gone ahead at Kenyatta National Hospital to introduce a golf cart. In fact, we have 2 golf carts at Kenyatta National Hospital, which receives these patients at the bus stages and indeed take them to the cancer center. Those who go through chemotherapy, some of them after that procedure are usually very weak, they are fragile, and then we take them back to the bus stage. In fact, including the KMTC bus stages. You also use the same golf carts, which is actually does not use fuel, is actually electrical, does not cost us anything, and we navigate them through all the different areas of the hospital. So, Your Excellency, we take this very seriously, and therefore we're going to see how best we can review to make these people comfortable. Thank you, sir.
Thank you very much. I think we've gotten some useful feedback from those 2 great Kenyans. Please proceed.
Thank you, Your Excellency. Because of what was said of the referrals, if the public facility is working and a patient is referred out, chances are it's a healthcare worker that is doing the referral. So I think we bring in the healthcare workers now to give their comments also on that particular issue and any other that they may have. Any healthcare worker in the room? There's a hand up there.
Thank you very much, Your Excellency, and the government officials here. So first of all, to respond to my brother and my boss, Honorable Sakaja, it's true. I'm Dr. Dennis Miskela, the Deputy SG for KMPDO, the Doctors Union. It's true that we come from Kenya. Even these healthcare workers are Kenyans. So we know we come with our weaknesses, that in this sack of healthcare workers, there are rotten apples. And as KMPD, we never shy or defend when healthcare workers make mistakes. We also fall sick. So we know that sometimes that motivation to get that extra money through all those bad ways are there. But then again, as healthcare workers, we will also not sometimes allow ourselves with the punching bag that when there's no drug, wameiba madawa. When the machine is broken down, wanatuma watu nje kupata hizo pesa. Sometimes genuinely those equipment break down. Sometimes genuinely those drugs run out. So let us not punch the healthcare worker. They really go through so much to help. But what I can say that, please, can we have a proper feedback mechanism where the citizens themselves can report? Because even this debate, Your Excellency, about SHA not working, is not because SHA is not working. It's because somebody has paid for SHA, but when they go, apart from the consultation fee, they have to buy drugs outside, do ultrasound outside. They get frustrated. So what do we do instead? Why can't we have a setup where the governors can promise this summit that drugs will always be available? Not every time you see a lorry bringing cartons, they are bringing the drugs that we asked for. If we could ensure that when a patient walks in through the hospital, and I'm glad that DHA has put that system, that when you walk in to when you walk out, you don't pay for anything or buy anything outside. But to expect citizens to come and pay for SHA, then everything else they buy from outside is a problem. But as I move to something else, that right now the healthcare worker is the most demotivated cog in UHC. Why do I say so? Because on the pillars of UHC, there are certain things. Financing is one of them, and SHA is doing a pretty decent job on that, I won't lie. We have negotiated the US government deal funding around the HIV and TB. Perfect. Financing, we are doing a good job. On On the issues of KEMSA reforms, 80%, 90% fill rate, perfect. We are doing a good job on that. Infrastructure right now in this country, within 5 kilometers, there's a hospital. And we just saw a deal of 13 hospitals, 300 beds being done in almost 13 counties. A decent job. ICT and record keeping, good job digitization. The biggest challenge that we must face is the human resources of healthcare. As we sit here, 33 counties have not paid salaries. That's a fact. And they have to pay rent still and go to work with fuel. As we speak here, we have healthcare workers who on the 9th of every month can't access care because governors have not sent money to SHA. SHA has locked them out. So you offer services that you can't get yourself. As we sit here, people are on strike because certain counties, after Ministry of Health availed 8.6 billion to absorb UHC workers, the counties refuse to take them. So we must discuss. Yes. We must discuss as a country, and I really read your manifesto back to back. You say that you have felt the pain of the healthcare worker, and you promise to be a neutral arbiter without compromising devolution. And this beyond 2030 discussion, we must let Kenyans decide, are they happy with how health is being run in this devolved system or not? We are not fighting devolution. We are not fighting devolution. But why can't we let primary health care, level 1, 2, 3, be run by the counties? Then the complex, expensive 4, 5, 6 be run by the Ministry of Health. So that if the counties fail, then the 4, 5, 6 is working. If the 4, 5, 6 fail, then the 1, 2, 3 is working. To give Kenyans a reprieve. That's all that we're asking for. Make care for us, the healthcare workers, so that we can care for the patients too. Thank you.
Thank you. Thank you. Thank you very much, Dr. Miskela. Allow me to have a nurse. A nurse.
Yes. Okay, maybe we can listen to a nurse and then we can respond to Dennis because he has raised a very fundamental issue by way of feedback.
We have a nurse on this side.
Your Excellency, to protocol observed. I want to begin by saying that, Your Excellency, if there is something you did in this country that will always remember you, is to bring that man in the Ministry of Health. That Eden Twale in the Ministry of Health. And he has brought up a team that is actually working. Plus his PS, Uma Oluga, PS, the most smiling and the doors always open, Mary Muthoni, very welcoming and workaholic. And even Director General, Dr. Moth, and the entire team at the Ministry of Health. Your Excellency, these people are working today. Be as it is, Your Excellency. We can say we have, first I want to admit, because I must speak with a clean hand, I was one of the serious critique of SHA when it came up. And you know, you used to ask me, it is you who brought SHA because it is us that formed this government. Our issue was not about the services to be provided. Our issue, I was being pushed by the people I was leading. They were saying 2.7 was high. But I can admit to you, Your Excellency, that SHA works. Every month, I spend about 100,000 shillings supporting my people in my constituents. I pay between 6,000 and 12,000 every month. Everyone telling me I'm sick, I say, have you registered SHA? No, I cannot pay your hospital bill. Go, get assessed, send me the assessment, then I pay, you go get treated. It is working. Only that we have a few people who are very poor, they can't afford. You assess, somebody tells you, I have niko na nyumba ya mapati, kumbe the husband built a house and he died. So they give you pay 8,000, yet you cannot afford that. Maybe that's the area that may want to be revised. Your Excellency, I want to thank the Minister of Health. We have had problems, as my colleague said here yesterday. Every year we have been having problems at Ministry of Health internship. We fight, we destroy things, the Ministry of Health. There is one particular year where we broke things, the Ministry of Health, and the interns were surcharged. Today, as we are talking, under the leadership of your able CS, Honorable Aden Twale, there is no breakage, there is no maandamano on internship. That disease has been cured. Secondly, Your Excellency, the issue of universal health coverage, which you and your brother, former president, employed during COVID-19. Through his guiding and support and working with Parliament and all people responsible for revenue allocation, 8.6 billion was allocated for absorption of UHC staff into permanent and pensionable. But as we speak today, nurses in this country are on strike because the county government have refused to absorb these UHC staff. It is our prayer, Your Excellency, that national referral health facilities have acute shortage of nurses and other healthcare workers. Since you have the money, why can't the Ministry of Health just take these nurses and other health workers to the national health facilities? Your Excellency, we can talk about medical products and technology, health information system. Of course, the health information system, Your Excellency, has worked very well. You know, that's why yesterday you said that Kinamugos have been removed from the system. I will want to say, under that health technology, health management system, they should be linked to the medicines and even equipment, so that if Governor Sakaja has supplied medicine to Hospital A, there is somebody somewhere who is in charge of looking at the system and knowing that this medicine is in stock. So that if a client goes and is told this medicine is not there, and he calls that number you want to establish, a person who is not in that hospital will be able to call that hospital and say, our system shows this medicine is in stock. Why are you not giving out to the public, the patients? For us as nurses, we are happy because, Your Excellency, our services we don't refer. Nursing services, we cannot tell you go and get it outside. We will give it because we always have it. So we may not be actually affected by that. Your Excellency, a demotivated workforce, a workforce that has not been paid, cannot deliver services. As we talk today, yesterday, Your Excellency, you said all the county government received their share of revenue for the last financial year, 100%. County governments today, Your Excellency, have not paid statutory deduction and third-party deductions. They have not paid loans. They have not paid pensions. Some have not paid loans in the last financial year. As we speak today, August is coming to an end. Health workers have not been paid salary for July. They have not been paid salary for August, will end next week. How do you expect these health workers to go to work, to feed their children, to pay rent? You are embarrassing health workers in this country. If you are a health worker or a public servant and you have been paid salary and you don't pay for your rent and your landlord throws you out, Your Excellency, human resource policy requires that you are disciplined because you are embarrassing the employer, who is government. Now, since we are the ones being embarrassed, what do? Can we sack the employer? The only weapon given to us by the Constitution of Kenya under Article 41 is to go on strike. So we are asking, we open a conversation. Are we ready as Kenyans to continue having a healthcare system that is very critical in the hands of devolved system where only 9 counties, Your Excellency, in this country have had their budget passed up to now? 14 have never submitted their budgets. 24 have had their budget rejected. Are Kenyans ready to have the health human resource with these administrators who can't even have their budgets passed, who can't even afford their budgets? This is a conversation that we need to open.
Thank you. Thank you very much.
Your Excellency, the last one. I cannot sit with people saying this. I'll be lynched by members. I'll be lynched. Your Excellency, in 2017, you and President Uhuru Kenyatta gave nurses a return to work formula, where you improved our terms and conditions of service. From that time up to now, that return to work formula of 2017, Your Excellency, has never been implemented. It has been a cause for 4 strikes. including the one that's going on right now. I know you have goodwill, and you mean goodwill for this country. Through your goodwill, I'm requesting you to ask the chair of the Council of Governors to sit down with us on Friday, have a solution. And SRC should be on board. Because in 2017, we had that CBA, it was taken to SRC rejected. And today, even if we sit with Council of Governors and agree, and SRC rejects, the strike will still continue. So I'm requesting you, I know you mean goodwill for people, talk to the Council of Governors, SRC, so that we sit on Friday, because we have a meeting on Friday, we complete and send our people to go back and work. Thank you, Your Excellency.
Thank you. Do we have any other representative of healthcare workers?
Any clinical officer?
Okay.
He's up there.
Proceed.
Proceed.
Yes, and I'm very excited, Your Excellency, to be here today. I think the other time we met, Your Excellency, before you became president in Catholic University, I'm the one who gave you the memoranda on behalf of my good friends from the unions. And we have the other unions for public health and the other unions within the health sector with us here today. Your Excellency, there is something that you promised, and I remember you said that we keep the photos, so that in case you forget, we remind you with the photos. And Your Excellency, I think now I'll have to delete it. I was keeping it, but I never actually expected that we would have this forum. And you know, this is the first time we are having the head of state seated with us to discuss the matters health. We have been, as the unions for healthcare workers, even from the time our peers, Dr. Oluga, was a unionist like myself, Your Excellency, we were asking for health to be elevated to be a national agenda, and you have done that. And you promised when we met, you said that you are going to push for bold and deliberate reforms, and I'm happy that today, even those who are critical, and Your Excellency, I was one person who was critical at the start. One thing we agree on, they are bold and deliberate reforms. Maybe the other things that we are discussing is the implementation of the same. But where we are now, and you'll note that now the criticism has gone down, is because we have seen that it's working. I want to pick it from where my brother Ms. Keller and Seth Panyako have left. And sorry, I forgot to introduce myself. I'm Peterson Washira, the National Chair, Kenya Union of Clinical Officers. There is an opportunity within the Constitution, even without having to reverse ourselves to the national government. Under Article 189, the one that has been used to have cooperation agreement between counties and national government, it also provides that we can actually have joint authorities, either under the 47 counties or the 47 counties with the national government. And because what we are looking for is a unified system to manage healthcare workers, so that we have uniform standards across the board, for us, Your Excellency, we see a quick opportunity that if you can be able, through the Intergovernmental Coordinating Summit, deliberate under Article 189, it is actually possible to have a joint authority to be able to manage the health workers across the 47 counties under one authority. And Your Excellency, I must thank you because you inaugurated the KHRAC, the Kenya Health Human Resource Advisory Council. Since 2017, when the Health Act was actually enacted, this very important body that looks at the healthcare workers' welfare and the many things that are taking us on strike was very dormant, did not even have a board. But you took the step and you put it in place, and now we have an opportunity to be able within that system to provide some of the solutions that are needed for the same. So Your Excellency, for us, because you promised that you are going to be an arbiter, what we request is that you assist us so that we can have a joint authority. within this joint authority and within the mandate of the KHRAC, we can be able to bring our specialists from the counties to that authority so that they can be available across all the counties, because the Health Act 2017 provides that our specialists are supposed to be a national asset. And that means that they should be available across the country. But with the current setting, that is impossible. If we have an authority, then they will be under that authority and can be deployed across the board. Lastly, Your Excellency, it is not only nurses who are on strike. We also have clinical officers, public health officers, and all the other workers other than the doctors. And especially the case of clinical officers is much easier because we had already agreed on a CBA, but there are some counties that have taken long to sign. We were supposed to sign on 2nd of February, and there was an invite from the Council of Governors. But as we sit here, only 16 counties have actually signed. We don't understand why the others have not signed. And it's something that, Your Excellency, if you can be able to mediate, we can be able to conclude very fast. Thank you, Your Excellency.
Thank you, Peterson. Now, that's quite a handful of manenos, but I think it's very good feedback. Let's begin, and I agree that machines, computers, medical commodities are all good. But without the personnel, they remain items. And they cannot, they cannot amount to service. For it to amount to service, people must be there. At the heart of health delivery is the health workers. And let me say the following. Peterson has put me squarely on what I said when we had the health summit before the last election. And I'm very happy to see you, Peterson. We have not met since that time. The problem, you forgot to come with the photographs. and I already gave you the leave. I told you, keep these photographs so that in case I forget, remind me, tell Mr. Boss tulikubaliana hii. Unaona hii picha. But I guess you also agree that 80-90% of the things we agreed at the Catholic University, we have implemented. There are some outstanding issues, among them the issue you have raised, and I'm going to see how we can navigate so that we can take this forward. So human resource is a critical part, possibly the most critical part of the delivery of health as a service. To give it to the counties, and when I said I'm going to be an arbiter, you can confirm. And the chair of the Council of Governors here and the governors can confirm that the relationship between the national government and the county governments is way better than it has ever been. Because I deliberately chose to work with the counties, to engage in dialogue, and I must also say the counties have been very understanding. Whether it is the payment of CHPs, we've done it together. Whether it is the passing of the laws, they were always in the committees. Whether it is the equipment, the National Equipment Service, we have an intergovernmental partnership agreement. And everything else, we have worked together. Now, up to that point, we are good. You have raised, Dennis and my good friend Seth there, have raised issues that I'm sure the council will want to respond, because this is not a place for judgment. This is a place for feedback, so that We're encouraged for the things we are doing right. And we are pointed out the things that are not going on in the right direction so that we can improve. It is true what I said yesterday. And the chair of the council can confirm that we have transferred all the resources for last year. We never crossed with any shilling belonging to counties. And the money for July was already paid. The chair explained yesterday the reasons why some counties have not paid the July salaries. But what these good people, representative of health workers, Dennis and Seth, are saying is also correct. You know, our whole, if today is the 19th, right? 19th of August, and salaries of July have not been paid, there is a problem, you know. So we need to tidy up that, because otherwise we demotivate the most critical aspect of our health delivery. I agree with you, and if there is anything that the national government can do to support the counties on that matter, we are willing to go out of our way to support the counties so that that matter can be sorted out. The next issue is the issue you have raised on deductions, and that by the 9th, when SHA says that you haven't paid and therefore you cannot get service, I thought we created a bridge. I thought Mercy, you know, because it is not right that we don't provide service because an employer has not remitted the money, which they are going to remit anyway, you know? So I think that we had that conversation. I don't know whether Mwai or somebody or yes.
I'm being told to do it, Your Excellency, so because it's hot. Your Excellency, yes, we did have that conversation, and we agreed to move from the 9th to the 25th. We just need to tie up an agreement with Treasury and then be able to work that round. So we haven't implemented it yet, but you did initiate those discussions and give us the instructions that we sit with Treasury and move from the 9th to the 25th, at which date Treasury had committed that all monies would be with the counties and we wouldn't run into this problem. So it is on us, Your Excellency, we will need to implement that. Yes.
Yes, Adam. Your Excellency, this is a matter that we have discussed a number of times. That healthcare workers who are treating Kenyans on the 9th themselves are locked out. And when we were at the summit, I think why we kept is that, and the chairman was there at the summit in December, we found out that the majority of the counties were committed to paying before the 9th. Wajir is one of them that has been paying before the 9th. I think what we are not discussing here is the flow during the transition of the two financial years. But Treasury have been dodging. We just need to do an MOU with the National Treasury. We are the ones who pay both the national government and they pay the county governments. At times even we have a problem with our own civil servants, the chief contribution. So I think this is a matter that ourselves and the chair can now get just a final MOU commitment with the National Treasury, and we should not discuss it anymore. I think the healthcare workers, you can assure them of that commitment in the next 2 weeks.
All right. So let me tell the representatives of our healthcare workforce that this is feedback that had come to me and I had already given direction on what we should do, because it is not correct that a healthcare worker is providing a service to others which they themselves cannot benefit from. It's a contradiction. And secondly, this is a healthcare worker who has a contract. They are not about to run away in between the month. So whether it is the 9th or the 20th or whatever, they will pay finally. So to the good people, Dennis and Seth and Peterson, that is good feedback. I will deal with it. And we will make sure that no health worker is locked out on account of the county having not remitted their deductions, and then we will see how to work this out with the counties, right? Dennis, this is not a demonstration. Then the third issue which has been raised, and I will give you, Chair, I will give you time to respond, and also Abdul Samad. The third issue, by way of feedback that has come to us, is the outstanding CBA agreements with nurses and with the other health care workers, and the need for us to bring on board the Salaries and Remuneration Commission. The Salaries and Remuneration Commission, as we all know, is an independent institution, but we will socialize them to the need for us to have an agreement with the Council of Governors and with the health workers. So again, that is some homework for me. I will make sure that the SRC comes on board. I'm sure the Council of Governors will also do their bit, and they are here, they will speak for themselves. Finally, is on the issue of the staff, former staff of UHC. We did make available resources to transition these good people to permanent and pensionable. We made the resources available. We just have a minor issue between us and the counties, which we should be able, I think, Chair, ladies and gentlemen, let us sort this out. And let's give ourselves a maximum of a week and sort this out. I have given options. I have said, if the counties have a problem absorbing these workers, the national government will absorb them. So it is up to us to, but I would really, because I know the risk of us absorbing them as a national government, because it will undermine service at the counties, because we will basically be transferring staff from our county facilities to national government facilities, and yet at the county facilities they are providing service to Kenyans. In any case, we don't have national government Kenyans and county government Kenyans. We only have Kenyans. Yeah? So I think this is something that I undertake that between me and my good brothers and sisters at the county, we will look at it. Chair, and then Abdul Samad.
Your Excellency, let me have a first go at it, and then my colleagues will back me up. Your Excellency, we are good friends with these union people because you spend a lot of time with them as governors navigating these matters. But the things said here should not take away from what counties have been able to achieve in this sector. This morning when we were in the other hall there, we took cognizance for 5 years and I'm now here. I inherited Wajir with one doctor. I think that one doctor is here. Dr. Somo, I don't know whether he's here. He was in the hall today. And in my county, and I said it here last night, since you came in, and I said it here last night, since you came into office, we have not had instances of crossing over and merging finances of one fiscal to the other. It was very ordinary in the past for June allocation to be paid in July or in August. We have our June money. We have our July disbursement. But there is another matter, Your Excellency, of the treatment by independent officers and